Grad School 101 with Dr. Bradbury.
Hi, this is Dr. Bradbury. Welcome to another edition of Grad School 101. Today I'm going to address a question that I get asked by many students, and that is, do I need a master's or a PhD? Should I go for a doctorate in clinical psychology, or do I want some kind of mental health profession-related master's degree? And I think this is a fantastic question and one that many students ought to think about. We don't want to treat the PhD as just sort of a default degree that you're just going to kind of go toward no matter what. Instead, you really want to think about what you're going to do with your PhD. What are you going to do after you're done? What do you want to do as your career, right? What do you want to be doing for your job? And depending on what types of professional activities you want to engage in, we can then determine what would be the best degree for you. So one of the ways that I often think about this is just in trying to figure out whether you actually have to keep a PhD, keep a doctoral degree in the mix, or can you get away with just having a master's degree? Because of course, bear in mind that PhDs are much more expensive. They take a long time, even though many clinical psychology PhD programs are billed as being about 5-year programs. It can sometimes take you twice that long. So you really want to be very cautious about biting off a doctoral program if you don't have a very specific motivation for doing so. If you have a specific reason that you really need to go get that PhD, then that's going to really light that fire under you and help you stay motivated. Whereas if in fact you're saying to yourself, I think I could have just gone and got a master's, then that's going to be something that's going to sap your motivation over time. And I really want to emphasize here that a master's degree is an advanced degree. That right now, bear in mind that you're here at UT, and if you throw a rock around here, you hit 3 PhDs. We're thick around this place. There's tons and tons of people with doctoral degrees here, but that's because you're at a high-level academic place, and we have to have that particular degree in order to work here. So remember that out there in the real world, in fact, most of the time when I'm acting as a clinician, if I'm in a team meeting or if I'm in a place where I'm dealing with lots of other professionals, very frequently a master's degree is actually going to be one of those high-order degrees that's represented by professionals in the room. And in the real world, a lot of the time, if you have a master's degree, you are going to be the best educated person in any given room. So a master's degree isn't anything to be ashamed of. A master's degree is not something where you've kind of copped out and you should have gone ahead and gotten that bigger degree. Instead, think of a master's degree as being a type of degree that prepares you for particular things, and a doctoral degree as being a different type of degree that prepares you for different things. So let's talk a little bit about why it is that you might need a doctoral degree. So if you're thinking about getting a PhD in clinical psychology, there are very few clinical activities that require you to have a doctoral degree, but there are a few, and so it's good for us to talk about what those are. In particular, if you want to conduct what we call formal comprehensive assessments, if you do a formal comprehensive psychological assessment, this includes intellectual testing, that includes IQ testing and academic achievement testing. IQ tests are controlled such that the only people who are allowed to administer them are people with doctoral degrees. So you won't actually be able to administer IQ testing or do the types of assessment that require IQ testing on patients if in fact you don't have a doctoral degree. However, people with master's degrees can still conduct all of the other types of regular assessment that clinicians do on a regular basis. So they can determine whether their clients have depression or anxiety or whatever the other problems are that they are there to help with. So clinical assessment is still something that clinicians can do at a master's degree level. But if formal assessment, and in particular if you're interested in diagnosing things like learning disorders, if you're interested in working in a school setting having to do with those types of problems also, then probably a doctoral degree is what you're going to end up needing, because you're going to need to be able to be licensed at that level in order to perform that type of testing. That said, that is really pretty much the only type of clinical behavior, the clinical professional service, that requires a doctoral level license. However, there are a few other types of clinical work that functionally actually require a doctoral level license, because you won't actually be competitive for the positions that you would be interested in having. And that in particular includes forensic psychology. So if you're very interested in doing forensic work and you want to work with people having to do with different issues of legal involvement, right? Issues with the legal system and how that intersects with psychology. If you're interested in forensics, then you're probably going to need a doctoral degree. And that's part of the reason for that is because you're going to spend some of your time in court if that's something that you're specialized in. And very often judges and attorneys and courtroom settings really want you to be an expert with that sort of top-level degree in your field in order to be respected, in order to have the judge really hear what you have to say, right? So that's a good example of a type of work that you'll actually be much better qualified for if you go toward a doctoral degree, even though you're not required to have a doctoral degree in order to be able to do that type of professional service. Now, other than that, that's in sort of the clinical realm, right? Other than that, most of the reason to get a PhD has to do with the kinds of things that I'm doing right now. So many of my students know that I'm a clinician, and sometimes they ask me, like, why is it that you have a doctoral degree instead of going and getting a master's so that you could be a clinician with a master's? And there are a few reasons for that. One of them, though, is that I wanted to be able to do this type of academic work. If you're interested in teaching students, especially at the college level or above, if you're interested in teaching students, or you want to be able to do any kind of academic research, or you'd like to write a book, right, and kind of have fancy letters to be able to put behind your name, then probably the doctoral degree is the most appropriate degree. However, if none of those activities are the things that you're interested in, then probably a master's degree is absolutely the most suitable degree for you. And this is going to be increasingly true the more you know actually what you want to do. So, ironically, even though I think that sometimes we think about it in the opposite way, it is the case that many students who are best prepared for master's degrees are our students who best know what they want to do, how they want to pursue their careers. If, for example, you already know that you want to work with a particular type of population or a particular type of clinical problem, then a master's degree will be something that you can actually find a master's program that will be very suitable and will be specialized in that particular thing that you want to do. The more broadly trained you want to be, the more years of training you need. So if in fact you're a bit of a glutton for punishment like me and you kind of want to know absolutely everything and be able to handle any type of clinical problem, the more we go toward that type of orientation professionally, the more likely we are to need a doctoral degree instead of a master's, because a master's is just more time limited. There's only so much time that you're going to be able to spend learning all of these different things. So the more organized you are and the more likely you are that you actually know what you want to do, the more likely a master's degree will be something that you'll be able to find and do well in. Now, remember, of course, too, here that this doesn't address what type of master's degree you might want to go toward. And there are many, many, many options when it comes to actually how to get to a clinical situation, right? So if what you really want to do is work directly with people in a professional helping capacity, you want to do clinical work, perhaps directly with mental health issues, perhaps you're interested in treating substance-related problems, or there are problems of psychosocial adaptation to illness that you're interested in. All of these different types of problems are things that people with master's degrees treat routinely. It is also the case that many people with master's degrees now work with serious and chronic mental illness. So this is no longer a division. Previously in the past, we would have said probably if you're working with something like schizophrenia or some serious or chronic mental illness, what you want to be thinking about is getting a doctoral degree in clinical psychology, as opposed to a master's degree probably in counseling psychology or one of the other related fields that's licensable at the master's level. That distinction is no longer valid, and it is definitely the case that many of the people that I work with in hospital settings who are working with some of the people with the most severe mental health needs are in fact people with very appropriate master's degrees, either a master's in counseling, a master's in clinical social work, or a master's in any number of other related fields. So remember that a master's degree may absolutely be the most appropriate degree for you, and if you're thinking about wanting to pursue a clinical career, what you want to do is try to figure out whether or not there really is any reason to kind of be that glutton for punishment, or if you can go toward a degree that's going to be a little bit more time limited, a bit more concentrated, and get you faster where you want to go in your professional life. All right, this has been Dr. Bradbury with another edition of Grad School 101. Come back soon and see us.